Hi everyone, Dr. Sunil Dhand. Welcome to another video. What are the real everyday interventions that are most likely to result in huge potential improvements to our health and well-being? We in Western society have gone badly wrong over the last few decades in that we, and by we I mean media organizations, society in general, and medical organizations, put all our emphasis behind interventions, pharmaceuticals, drugs, other invasive interventions, and we think only along those lines in terms of what is going to improve our health and well-being. We're all supposed to be about evidence-based medicine. We hear that term bandied around all the time. Evidence-based medicine this, evidence-based medicine that. We're supposed to be all about looking at statistics, real data, and published studies. But do we really do that? And when we do we really have a sense of perspective and an ability to take everything in context and think in a wholesome way, a holistic way, about what will really result in huge percentage improvements? Because frequently, when you actually look at published studies of drugs, other therapeutics, it is often surprising what the percentage benefits are. They are often very, very low indeed, under 10%, under 5%, yet a lot of these interventions, frequently they are very expensive, but they are all we focus on. So I want to instead go over actual published studies on simple everyday lifestyle measures and look at the percentage improvements potentially to anybody's health and well-being. So I have a few published studies here and I'm going to go over them with you, give you an overview of what some of them are saying, which is truly incredible. So this first study was published in the Journal of Human Hypertension, and it is from 2007, titled Increased Consumption of Fruit and Vegetables is Related to a Reduced Risk of Coronary Heart Disease, Meta-Analysis of Cohort Studies. A meta-analysis is the most powerful study you can get. It's when you pool different studies together and look at all of the outcomes across different populations in different studies. A total of 12 studies, almost 300,000 people. So a lot of people in these studies. Now we all know that fruits and vegetables especially are very good for you. Everybody should know that, but look at what they found. Our meta-analysis of prospective cohort studies demonstrates that increased consumption of fruit and vegetables from less than 3 to more than 5 servings a day is related to a 17% reduction in heart disease risk. 17%. Okay? Then we have another study here from the British Medical Journal, so a top publication. Fruit and vegetable consumption and mortality from all causes, cardiovascular disease and cancer, systematic review, another powerful study, and dose response meta-analysis of prospective cohort studies. This one had over 800,000 people, 16 studies. So basically what they found was there was a significant inverse association which was observed for cardiovascular, that's heart mortality, and there was a hazard ratio for each additional serving a day of fruit and vegetables of 0.96, which means that for every extra serving of vegetables and fruits, there was a 4% risk for each additional serving. So you can think what would happen if all those servings add up. Now let's move on to a Mediterranean diet. Most of you have heard that a Mediterranean diet is very good for you. The basics of a Mediterranean diet we can go over another time, but it's rich in vegetables, fruits, other foods like olive oil, which are very good for you. So what this study was titled, Mediterranean Diet, Lifestyle Factors and 10-Year Mortality in Elderly European Men and Women. So it included 1,500 apparently healthy men and 832 women aged between 70 and 90 in European countries, and they looked at 10-year mortality, so 10-year death rates. And what they found was adhering to a Mediterranean diet with other beneficial lifestyle factors as well, like not smoking, physical activity, etc. They found, listen to this, among individuals aged 70 to 90 years, adherence to a Mediterranean diet and other healthful lifestyle is associated with a more than 50% lower rate of all-cause and all-cause specific mortality. Over 50%. That is unbelievable. Now let's move on to a Swedish study. This was published in the Journal of the American College of Cardiology. They did a cohort study of over 20,000 Swedish men aged between 45 to 79. And during an 11-year follow-up, these men who practiced a healthy lifestyle had an 86% lower risk of heart attack. 86%. And what they concluded was that over 4 out of 5 MIs, heart attacks, could be preventable with low-risk behavior. So what about strokes? Another terrible illness to suffer from, acute stroke. It frequently leaves people disabled. So this is a study from the journal Circulation, Primary Prevention of Stroke by Healthy Lifestyle. This was a cohort study among 43,685 men from the Health Professionals Follow-Up Study and over 70,000 women from the Nurses Health Study. What they found was, among the women, 47% of the total and 54% of the ischemic stroke cases were attributable to lack of adherence to a low-risk lifestyle. So between 47 and 54%, they were comparing the two main types of stroke, ischemic, which is due to blood clots, and included hemorrhagic, which is due to a brain bleed. And among the men, 35% of the total and 52% of the ischemic strokes may have been prevented by healthy lifestyle. How about physical activity? We know that physical activity is extremely beneficial. The European Society of Cardiology in 2016 put forward a study where they looked at moderate physical activity. And what they found was that moderate physical activity, this was a 12-year study in nearly 2,500 adults aged between 65 and 74. They found moderate physical activity is associated with a greater than 50% reduction in cardiovascular disease in over 65s. And high levels of physical activity led to greater risk reductions. That is incredible. But how about just walking? Well, a study published in the New England Journal of Medicine, supposedly one of the top journals in the world, back in 1999, so more than 20 years ago, looked at over 72,000 female nurses who were between 40 to 65 years old. And what they found was there was a strong graded inverse association between physical activity and the risk of coronary events. Walking was inversely associated with the risk of coronary events. Women in the highest quintile group of walking, who walked the equivalent of 3 or more hours per week at a brisk pace, so not that much, had a multivariate relative risk of 0.65, so a 35% risk reduction. And regular vigorous exercise was associated with similar risk reductions, 30 to 40%. And what about cancer, one of the other horrible diseases out there? And we are seeing increased rates of many different types of cancer for many different reasons. But here's a study from the Journal of Clinical Oncology. Over 750,000 people with a median age of 62, 53% were female. They were followed for 10.1 years. And what they found was that engagement in recommended amounts of activity was associated with a statistically significant lower risk of 7 of the 15 cancer types studied, which included colon, breast, endometrial, kidney cancer, myeloma, among them. So let's think about those numbers there. They are truly astonishing. And make no mistake, if there was ever a medication or a therapeutic that had even a fraction of those percentage improvements, it would be blasted all across our TV screens. There would be commercials everywhere. We would all hear about it. Think about the numbers of people involved in those studies as well. Frequently over 500,000, over 800,000 people. These are very powerful studies that are showing huge, enormous benefits simply from lifestyle. Any medication or therapeutic out there, any big pharma company would dream of that sort of percentage improvement. It's simply unheard of with most medical therapeutics and drugs today. So why the radio silence from the authorities? Why are our health authorities not going all out with this message? We may hear the odd statement every now and again, but hardly anything. There's of course no money in simple lifestyle medicine a lot of the time. That is true. And I'm under no illusions. We're not going to suddenly make people have healthier lifestyles. But if doctors and public health authorities are not going to be all in on this, then who else is? We owe it to ourselves in the medical profession to give this sort of perspective and present this reality of what will really improve people's health. It is simply inexcusable that we are not doing this. So to conclude, I want you to always remember the percentage benefits which can be gained through simple everyday lifestyle measures. They will save you potential expensive medications, therapeutics, drugs down the line if you follow these. Now, I often tell my patients that health, like a lot of things in life, is simply a numbers game. It's all about what can you do to lower your percentage chances of illness and improve your chances of success. Like a lot of things in life out there, it's all about things adding up over time. And of course, there are no guarantees in life. There are absolutely no guarantees. The most we can do is try. So when it comes to what modern day medicine and healthcare is all about, we truly have lost our way. I feel in Western medicine, we are completely lost and we forget what really will bring about true benefits in our patients. And they should always be first and foremost on our minds. And we have to be all in on this. And I hope that the doctor of the future will firstly prescribe lifestyle before anything else. That would be the right road to go down. Medical community, we have to do better in this regard, and we have to consider if we truly are all about evidence-based medicine, we cannot forget the things out there that are going to produce those huge benefits in our patients, and we have to keep talking about these things. Thank you everybody for listening. Dr. Sunil Dhand. Do hit the subscribe button down below if you liked this video for more similar videos in the future. You can also follow me on my news channel, and please, if you haven't already, subscribe to my newsletter because that's a great way for us to stay in touch. I could talk for a long time about the current atmosphere of censorship and how corrupt modern media and US big tech is. But I want a way to stay in touch with you directly and talk about things that we can't talk about here in this more constrained environment. Thanks everybody for listening, and we will talk again really soon.